My name is Raine, and I'm a professor in the Center for Health Promotion Studies in the School of Public Health at the University of Alberta. I also hold a CIHR and Heart and Stroke Applied Public Health Chair, and that chair is focused on promoting healthy weights through interventions at a community level and also at policy levels. So I have two major research projects that are going on right now. The first one is a community-based intervention project to promote health and to decrease obesity, and that's called Healthy Alberta Communities. And the second project I'm working on is called the Alberta Policy Coalition for Chronic Disease Prevention, where we're attempting to apply lessons learned from tobacco reduction to physical activity and nutrition to help stem the tide of the obesity epidemic. At TOS in Orlando, I presented a project called Healthy Alberta Communities, and it was a 5-year intervention project. It was a very strong partnership between the university, who basically designed the program and did the evaluation, the Alberta Health and Wellness, who were our funders but also partners in the design of the project, and then the 4 communities, the 4 pilot communities we worked with within Alberta. We had 2 rural communities and 2 urban communities. And basically we used the Angelo framework from Boyd Swinburne and held workshops in these communities so communities could identify what were the challenges to healthy living in their communities. What were the factors in the environment, the physical, the economic, the social, and the political environment that were basically making it difficult for them to eat healthy and be active. And then through those workshops, we identified projects that we could work on to improve their health. There were several projects in all of the communities, but I'll just give you an example of a few. One was the Healthy Choice restaurant program in the town of Bonnyville. Well, Bonnyville is a little oil boom town, and lots of transient workers who come into the city to work Monday to Friday and then go home somewhere else on the weekend. A lot of them live in hotels, don't have places to cook, and needed to have healthy places to eat. So we worked with local restaurants to develop criteria for healthy choices, and then we promoted those restaurants through the media, and the project was very successful and is still ongoing. Another project was addressing food insecurity in a very transient, low-income, disadvantaged neighborhood in the city of Edmonton called Norwood, North Central Edmonton. And we worked to address food security, but not through the traditional way of using charity, but to connect the local community to local farmers and develop good food boxes that people could buy at a reduced price, so they could get access to fresh fruits and vegetables at a reasonable price. So the results were really positive in all 4 of the communities in terms of improving food security and also for improving a sense of belonging to community. One unfortunate thing, we have not yet seen changes in general overall diet, for example, increased fruit and vegetable intake in the entire population, and we have not seen improvements in physical activity and nutrition or in obesity yet. However, we are working now to extend this project based on the early preliminary findings. We're working to extend it over 100 communities throughout Alberta, and then to work to develop community-level surveillance systems so that we can monitor changes over time. We really think that these small projects are just the beginning, and we really need to change the culture of these communities, of all communities, to promote the healthy choices, the easy choice, and it's going to take some time. Things that we did in the city of Medicine Hat is to try to promote physical activity. We developed a coalition for active and alternative transportation, and basically people in the city were interested in connecting the multiple trails that were being built in sort of the further out areas so that people could use them to walk or cycle to work and such. And so we now partnered with the city and the Be Fit for Life Centre, who now is taken over the sustainability of that project. So we have a network of trails being maintained within the city of Medicine Hat. For more information about the Healthy Alberta Communities Project, you can go to www.healthyalbertacommunities.com.